we're going to ask about how the recommendations proposed by the EU Health Commission could contribute to a stronger EU health union. Now, let me introduce our panelists. Not everybody is here yet. We're expecting Despina Spanu, who is head of cabinet for Vice President Skinas, but she's in a meeting, but she will be with us at some point. And this mystery person, Annabelle Ferrini, is not actually Annabelle Ferrini, but it's Delors Montserrat. Are you there, actually, MEP Montserrat? No, I think perhaps she's not here yet. That's the name of her assistant. Anyway, we are delighted that we have got with us Nicola Bedlington, who is from the European Patients Forum, special advisor. And the Patients Forum, of course, is one of the key organizations of the EU Health Coalition, so always great to have that patient voice. And from Portugal, we have Dr. Rui Santos Ivo, who is the president of Infamed, which is the Portuguese Authority of Medicines and Healthcare Products, which, of course, evaluates and authorizes and regulates medicines. And I think you're also a member of the management board of the European Medicines Agency. That's correct, yeah? And Portugal, of course, has the next presidency of the council. Don't worry, we won't expect you to answer everything on behalf of the presidency, but we might ask you some thoughts on that. So let me ask, first of all, you, Nicola, to give a sense from a patient's perspective of really how you think EU health policies are going to be shaped by COVID.
Thank you very much, Kathy. You can hear me okay, I guess?
It's perfect, yes.
Excellent. And thank you again for the invitation. It's a pleasure to represent EPF on this occasion. As you said, we're also a dedicated member of the Health Coalition, and we're part of it right from the onset. So COVID-19, from our perspective, this has been and still is not only a health crisis, but also a humanitarian and economic crisis with profound implications, really far-reaching implications for patients across Europe. We've witnessed many gaps and weaknesses, not only in systems, but also in policies that have really been brought into sharp relief due to COVID-19. And patients with chronic diseases, with long-term serious conditions, are directly and heavily exposed to any disruption in healthcare provisions. Their needs are ongoing and cannot simply be put on hold. But the huge economic impacts affect disproportionately patients. We've seen that through the financial crisis in 2008, 2009, really widening broader inequalities, but certainly health inequalities, and this needs to be taken on board. I think Michael Marmot's work on the social determinants of health brought that very much into focus. I think some of his excellent commentary on the impact of COVID is really super important. Continuity of care is a huge issue. Any treatment delays, checkup cancellations because of prioritization of COVID-19 patients is a huge concern, particularly for cancer patients. And the UCL published earlier this year quite a sobering modelling study that indicated there would be 20% more deaths from cancer in the UK in the next year. So clarity and certainty of access is critical. Changes in diagnosis, treatment protocols, social distances, behavioural change and fear are all impacting hugely. We've seen shortages of medicines and technology, which again is not new, but it's been exacerbated by the crisis. Surge in demand, stockpiling in some countries, etc. And this is now being addressed again through collaboration between the European Commission and the healthcare industry representation. I think it's also important, again, from the patient's lens, to think about the human rights dimension of this crisis. And Alzheimer Europe, one of EPF's members, called out against the discrimination practices, highlighting restricted access to ventilators during the pandemic for patients living with Alzheimer's. And they called very clearly for the principle that when triage decisions become necessary, they should be based on an individual's prognosis, not simply on age, condition, or place of residence. And then another dimension, I think, which is also clearly important, and there are a number of healthcare professional organisations represented within the Health Coalition, the impact of the healthcare professionals during this crisis, making these kind of decisions, the mental health impacts for everybody, I think needs to be really thought through very, very carefully. It has at the moment, in my view at least, been somewhat understated. Clinical trials, another topic, but also really central. Many clinical trials were suspended initially, and then another really profound impact for example, a patient at stage 4 cancer for whom no other treatment option is available. So really, really harsh impacts on individuals. And of course, the guidance that the EMA produced to modify clinical trials to allow remote monitoring was absolutely critical at that time. But more generally, and I think it's been alluded to during the course of the day, the acceleration of digital health generally, really important. And of course, telemedicine has really come into its own. So broadly speaking, our attention, all of our attention must be turned to enhanced European collaboration and competence to really ensure our health systems emerge more prepared, stronger, and indeed more people-centred. It is, as Andrea said, an opportunity for learning. And the recommendations of the European Health Coalition represents a clear way forward for advancement, for improvement, health leadership, coordination, multi-stakeholder partnership, involvement of regions and cities, appropriate investment and coordination in research to actually foster innovation, not just therapeutic innovation, as important as that is, but also technology, social and systems innovation. Data, really managing data in a much smarter, people-centred way, looking at the potential of the European health data space and indeed interoperability across the entire continuum of care, which will help to address some of the really wicked problems that I alluded to a little earlier. So, Kathy, a whole range of issues that need to be thought through from the patient's perspective, but some clear solutions out there as well.
Thank you very much indeed. And maybe now I could ask Dr. Ivo, I hope your microphone is going to be okay.
Yeah. You can hear me?
Yes, it's fine. We're now joined by Delors Montserrat. Let me just say hello, first of all, to you, and then your microphone is not on. You need to unmute your microphone at the bottom of the screen. You just click on the little microphone at the bottom of the screen. That's it. That's it.
I had some problems to get in. I don't know what it was.
Well, we're delighted to have you. We're delighted. Let me just introduce you to everybody watching. So that, I mean, a lot of people will know you, member of the European Parliament from the EPP, member of the Committee on the Environment, Public Health and Food Safety, and a former Minister of Health and Social Services in Spain. So obviously just the person we need on this panel. We're just asking everybody what impact COVID is having on health policy, or likely to have. So I'm just asking that question of Dr. Ivo from Portugal, from Infomed. So if you'd like to continue then, Dr. Ivo, that would be great. Thank you.
Kathy, thank you very much. First of all, I would like to thank for the invitation to be in this meeting today. It's a pleasure for me to take part on this discussion, and thus I'm very pleased not to be only with all the members of the panel, but also to see again Delors Montserrat from Ministry of Health. We've been in many occasions in the past, and also in Nicola Bedlington we have worked in previously. So I'm pleased to be here, and I'm pleased to give some initial thoughts on your question. Of course, I think what we have seen from the pandemic is that this has probably helped us in seeing in a more clear way where are our needs in terms of patients, our needs in terms of health systems, and I think this was really a result of this situation. I have lived myself a very concrete situation when early in March, April, we were all looking to get the equipment, to get medicines, and to respond to the needs, and we were trying to see how we could work together, and perhaps we were not able to do so because we were caught by the situation without having a clear mechanism in place to allow us to work together. So clearly, this is for me the first aspect. So issues like communication, like collaboration and coordination are now very visible, that these are needs, very concrete needs that we have to put in terms of concrete responses. I think this should be seen for me in two levels. So the European level, where we need to identify where we can act, in what kind of aspects there is the added value of the EU, but also how this can support our actions at national level. So this discussion on health policy should clearly have these two aspects in parallel. There are two areas where I see very good examples where we have started working more closely. One is related to the availability of medicines. This is a very concrete example. I think it's very important we move into concrete terms. That this is an aspect that I wanted to emphasize, because this is probably what our citizens are asking from us, is how to respond to concrete issues, and so we need to have concrete action. So the availability of medicines, so how we can respond together in more efficiently to avoid that some countries do not have medicines they need, or do not have the equipment or the medical devices they need. So this is one very important aspect that I wanted to underline, and I am very pleased to be myself working together with the European Medicines Agencies and with my colleagues in the other agencies of the EU in this respect. The other example I wanted to bring is what we are doing in relation to the access to medicines. I'm thinking now in concrete terms on the vaccines. I think this is a very difficult work that we are doing, because it's very challenging from the need to respond to expectations and to explain what is being done, because we are doing at so early stages that it's quite complex to explain that you are buying vaccines that do not yet exist. So this is clearly an example where I see the advantage of doing this together, because we can also manage not only the expectations but also the risks that we face. So these are examples of areas where I think we should build upon in the next period. And I'm pleased to see what are now the more, let's say, the initiatives that are being brought by the Commission in terms of the pharmaceutical strategy, for example, and other initiatives. I think I will still have the opportunity to come back on some of the issues that we want to pursue during our presidency. But perhaps I stop here for now. Thank you.
Thank you very much indeed. You probably saw that Despina Spanu did join us, seems to have disappeared again, but at least she's somewhere in the vicinity. But anyway, Dolores Montserrat, thank you for being with us. We got the sense there from Dr. Ivo that he thought communication and collaboration during COVID was not good at a European level. There has been a lot of criticism of the European response. So what are we going to learn for the future then to shape EU policies that are going to make a difference?
Thank you very much. To me, it's an honor to be here with a lot of friends. It's a pleasure, Ivo, to see you again. It's a pity that we have to see by remote system, but we are really close to. So thank you very much, and to Despina, to you. The COVID pandemic has shown that health threats do not respect borders, and why a more coordinated European response is needed. the speed, the magnitude of the impact of COVID and the lack of coordination in the early stage of the pandemic, much has been achieved through the joint response of the Union. The health and socio-economic crisis generated by the pandemic has put all sectors under tremendous pressure while representing an unprecedented opportunity to rethink the organization and management of national and cross-border healthcare. The time to apply the lessons learned has come. We need to strengthen existing agencies such as the ECDC and the EMA and create new ones, such as the Agency for Advanced Research and Development in Biotechnology, BARDA, which the Commission has proposed. We need to encourage European manufacturing of medicines and medical devices and review the European Union's industrial and production strategy in order to reduce excessive dependence on third countries out of European Union. New common treatment structures must be established and regional hospitals of excellence specializing in pandemic service, and not only must be created, we need to rethink the role of primary care. For me, it's one of the most important points, betting on their potential to relate to families on a day-to-day basis to improve prevention and promote a greater community response capacity to health threats in close coordination with hospital cares. The need for COVID vaccines as a durable solution accessible to all to overcome the pandemic shows us how essential it is to invest in the European research and to activate joint production, purchase and distribution process among all member states as never before. And we need to have European stocks of protective equipment and medical devices, thus strengthening emergency response capabilities and establish more and better organized and coordinate procurement, storage and distribution process at European level. So the high mortality rate of COVID among the elderly in nursing homes shows the urgency of promoting a European reform of the sector. So we have a lot to do. We can do it, but we have to do it all together. The European institutions, the state members, the patients, the industry, all the professionals, so all the stakeholders. We have to do it together. I think so that the COVID is tremendous for all the European citizens, but in the same time, it's a big opportunity for the future, for the present and for the future, to be prepared again Europe. So I think so, I put the focus in 5-6 points that we have to improve, and we have to do it together.
Okay, thank you very much indeed. So just to remind you before I go to Despina Spanu that please do send any questions on Slido. We're not using the chat function for questions, but we are using Slido, and it's hashtag Time for Action is the code on Slido. So Despina Spanu, lovely to see you. Thank you very much for joining us. I know it's been a bit of a rush for you. Head of Cabinet for the Vice President Margarita Schinas, who is Commissioner for Promoting the European Way of Life, which is a very wide portfolio, but he's talked about the need for a Europe of health. So health is part of it, isn't it? So tell us, I mean, a lot of people have already spoken about, our other panelists have spoken about all a shopping list with lots of things that need to be done in terms of furthering a health union. So what's your perspective in the light of what's happened with COVID?
Thank you very much for inviting me. I appreciate a lot seeing Mrs. Montserrat. It's an honor to speak in the same panel with you and, of course, with Eva and other friends from the health sector where I've worked for years. Indeed, promoting the European way of life for the portfolio of Vice President Schinas includes health, includes borders, includes a lot of things that came together actually during the COVID crisis. And in fact, for me, the biggest impact of COVID was to show us that the pandemic is not just about health. It is where health policy comes and meets everything else, and where the discussion as to whether in the EU we have competences in health or not starts becoming less relevant. Because at the end of the day, when you're faced with a crisis like the pandemic, it is a crisis. It comes from the health area, but it is a crisis. And you need to deploy all means you have through the internal market and the cross-border system, which is the beauty of the European Union, in order to address it. So I think what we learned here is that COVID being a pandemic is not just looking at it from the health policy perspective, but also from the internal market perspective. And of course, this in turn made us think twice about how we do health policies in the EU every time we need to touch on the subject. So I think the first impact is to think beyond traditional health policy making. Because to make policy making, you don't just need to think to the link to human beings. You have to think of the link for what keeps a human being going. And that is medicines, medical equipment, medical stuff, goods, services, and all that is happening through cross-border means in the European Union for decades now. So we have to think beyond just health policy. How do you address a disease? How do you address prevention, diagnosis, treatment? We had to go beyond that, having to have the means to deal with the pandemic. It also showed us we need more cross-border systems. Not only we need to preserve what we have, we need more. Look at the issue with the tracing applications. We managed to convince member states to go for tracing applications because they can be fundamentally important for making sure that you prevent the transmission of the virus. But at the same time, then we realized that when it comes to cross-border, we didn't have a system. So we created now a European system, and we're hoping more and more member states will take it up. For now, only 3 have done it. But this is a place where we need more cross-border systems. We also needed better coordination in the internal market. When the pandemic hit, we were found in front of a great surprise. We didn't have enough supplies of protective equipment like masks or medical protective equipment, even within member states. And there we realized that had we had the system of mobilization across borders depending on needs, then we would have been able to deal with it better. It is eventually what we did, and today we no longer face the shortages of such equipment, but it took time for us to realize. And of course, it gave impetus to the need for a European Health Union. I think this is something you will see us talking about more and more. You mentioned that Vice President Skinas has mentioned it, Commissioner Kyriakidis as well. The President herself said it in her State of the Union address. Europe cannot stay out of the area of health anymore. We need a true European health thinking, and I think that's happening now. I think people have realized we need a mindset change, and this is probably the most important change that was brought by the impact of COVID. Thank you, and we can continue the discussion.
But can I just ask you, and when you say that there's a change in mindset, though, because traditionally there has always been this huge resistance from member states for Europe to be involved in health, and yet you're saying now it really has to be much more widespread. Is that mindset changing enough to allow that to happen?
I think so. We had a very interesting situation in the last European Council. First of all, you know that now all of a sudden heads of state in their summits have started talking about health. It was never the case before almost. It was only in the context of crisis. We have this week the leaders outside the summit having video conferences to discuss how they deal with it. They realize there is an interdependence when it comes to dealing with the pandemic. So at the last European Council, there were calls for the Commission to come up with recommendations for color coding when it comes to how severe the situation is in regions in the member states, for joint procurement. Joint procurement after the crisis of the H1N1 influenza, not avian, it was the second big avian influenza that we had. It was in 2006, and in 2010 we had the first human influenza crisis. And we started working on joint procurement for all the member states then, and we only managed to come to a conclusion 2 years ago. It took us 8 years of negotiations. Today, we do it within a matter of days, and we subsidize it with European money. So this shows the mindset. When all of a sudden, when it comes to money, we can also pay for the procurement of vaccines, for the procurement of rapid tests. We will come up with that soon. I think this really shows the turn and of the direction when it comes to health issues.
But Dolores Montserrat, you talked about giving greater powers to the European Centre for Disease Control. I mean, it hasn't really got many powers at all, has it? I mean, it can't make any real decisions. And I mean, how far? What sort of new powers would you like to see? What would you like to see the ECDC being able to do?
I'm here again. Look, this summer, what we see? This summer, we see European Union, but each country taking different decisions in all around Europe. So sometimes the European citizens, they feel weird. What is happening? Why, if I'm coming, for example, from Greece and I'm going to Belgium, I don't have to do quarantine. And perhaps if I'm coming from Spain, I have to do quarantine. But if I'm coming from Spain and I'm going to Germany, I don't have to do a quarantine. In Netherlands, perhaps I have to do a quarantine of 7 days. And perhaps in Belgium, I have to do a quarantine of 15 days. So this kind of acts and things cannot happen in the European Union because we are in the European Union and the word says union. So I know that the competence of health, they have each state member. But this is the reason why we have to work all together in the European institutions and the state members to have ECDC with more competence, with more power, leaving with the Commission the measures that every country has to take with the same criteria in all around the state members. So now in the Parliament last September, in the plenary of September, the Parliament, we try to ask to the Commission with a resolution and with the ECDC that we have to have just one map every week. This map has to include the rouge, the red zones, the orange zones, the green zones, and the same requirements to all the European citizens for the same conditions. So this is the reason why the ECDC has to have more competence. We have to lead from the European Union to the state members, and then the state members, they have to lead and coordinate with their own regional governments, for example. So, here in the second wave, we see this kind of disrupted acts that the European citizens, they didn't understand. For example, I'm the chair of the Petty Committee in the European Union and in the Parliament, and you know that this committee, we are receiving all the petitioners all around Europe, and we're the bridge between the citizens and the European institutions. And one of the most questions that they were asking is why you are treating different the European citizens inside of the European Union. Despina was explaining a little bit about, that it's a big thing that we have to do it all together. And this pandemic gives us a big opportunity to say, okay, let's do it, because the next pandemic or this second wave, we know that the pandemic it doesn't understand about borders. So let's do it all together. This is the problem, and so this is the way that we have to work, Commission, state members, and ECDC. But at the same time, for example, EMA, the European Medicines Agency, with safety, with security, always, of course, we have to try to be more fast approving the medicines or treatments about COVID, for example. But always I'm saying evidence, of course, scientific evidence, and safety and security. Of course, we have to protect always the security and the safety for all the citizens and all the patients. But of course, this pandemic gives us this kind of opportunities, and we have to push to give more power, more competence, and to lead from the European Union with the coordination with the state members and the regional governments, the same protocol, with the same protocol, with the same measures in this pandemic.
Okay. Well, thank you for that. We've got some questions coming in from the audience, and there's one here. Perhaps you'd like to take this, Nicola. It's what about the policy measures that are needed to overcome the backlog of diagnostic, surgery, and medical appointments, and to assure access of healthcare for non-COVID patients?
is a topic that EPF is clearly, it's front and center of a lot of the work that we're doing. We've done a lot of collaborative work with the European institutions, with the Commission and the Parliament to really put this on the political agenda. There's no easy solution, but we just need to make sure that the focus is also on patients with chronic diseases, but also the whole phenomenon of long COVID, because people who have acquired COVID, it seems, are actually in some cases ending up with what are potentially very long-term conditions. So there is a really, really big and urgent need. I think some of the work that we've talked about in terms of digitalisation, acceleration of digitalisation, health data, sharing of knowledge, etc., is really, really important. But I think capacity is a massive issue, and an investment in health systems really, really key. I think the other important point is to actually involve patients with chronic diseases meaningfully in finding the solutions. They're not simply an expensive problem to solve. Using their experiential knowledge and expertise can mean we can look at getting rid of waste in the system, getting rid of redundancies, and really focusing on what matters to patients at the end of the day. And this is a policy thrust that EPF has had for years. We've looked at health system design, health systems and service design and strengthening with the voice of patients, and never has that been more important than now. Also, meaningful patient involvement in innovation, from research prioritization right through to real-world data, real-world evidence, with involvement, intrinsic involvement, not only of patients but of citizens, will play a key role. I think blending this emerging science of patient engagement, this great reset, according to the World Economic Forum, and striving towards the aspirations of Sustainable Development Goals will help to define the next decade. But putting patients and people absolutely at the centre is key.
Thank you very much. There's a question here about cross-border healthcare systems. What is the European Commission preparing in terms of concrete steps, a framework for European health records? The question is. Despina. Your microphone is, yeah.
I'm sorry. Is it all right?
Yes, it's fine.
I think that this is interesting. It's a piece of work that I happen to have worked with myself in the past. I think the health records is a very good area to start with. We already started a couple of years ago with a recommendation on how to make the electronic health records interoperable in Europe. Because, of course, every country has a different system, and very few countries have rendered their systems interoperable so that you can access them from another member state. So we created a format that every member state could use, especially because some member states don't even have an electronic health format. There are member states within which you have different health formats for their health records between different hospitals. So this is a first effort. It's probably time to go further than that, because now we see that with the pandemic, this could have been an element that could have been linked to the tracing, for instance, also to better the understanding, gathering data on treatments, on other statistical information on this virus that seems to be very unknown to us, and we need information on how it behaves at any given point in time to understand its mutation. So this is definitely an area where we need further push. Member states, of course, have a lot of reticence because there are privacy issues. This is the first concern of citizens when it comes to an electronic health record. Citizens don't have a problem. We have done a Eurobarometer. They don't have a problem sharing the health data, but they want to know when that is done, and they want to choose who they share it for. So I don't think anybody will have a problem sharing data if they have been a patient under COVID today, but it's a shame we don't have a system for that. We did the contact tracing application, That's a start, but I think we're getting there. So this is definitely an area we're working on and where more should be done. Possibly, as you have seen in our work program, in the revision of the Cross-Border Healthcare Directive, a directive that was it was a very difficult challenge, actually, for Europe to come forward with many years ago. It's still not working to its fullest, not even to its minimum capacity, I would say. It's not being taken advantage of. And that's why we need to see how to make it work better for people. And maybe in that context, we need to also add the system, something like a European health record system, to help people.
Can I bring in another question here that maybe Dr. Rui you'd like to take, which is that talking about when we need more health investments than ever, how can we avoid national health budget cuts in the coming years due to the economic downturn caused by COVID? I mean, it's going to be a huge issue, isn't it, that budgets are going to be squeezed everywhere at national level. And does that mean that in somewhere along the line that there has to be more European money? I mean, how do we tackle this?
For that question, yes, I believe that there is clearly an area where the EU can play a role in supporting the health systems in developing their infrastructures, which clearly became evident now in terms of the need. So this, I think, the programs that are being launched could help in this respect. But also, I think there is also areas where there can be the European dimension. I have the experience, as I said, more close with the area of medicines, and we now see how we can perhaps use better the tools of a digital tool. So I think also in terms of data, in terms of exchanging information amongst the different systems, this is something that I think it could be also be supported by the Union, not only the collection of data, but also to build, for example, when we are talking about shortages, we need to have a system that is clearly operating at EU level. We don't have it. If I want to know about a certain product in the different member states, we are sending mails around. So we don't have a system for, let's say, basic needs that we all have. So there is clearly room for this involvement and supporting this kind of investment. Also, of course, helping the transparency of the information. So I think this is clearly an area that I think we should push forward.
And what somebody says, how can we give citizens in Europe the feeling that Europe is there for them in these difficult times? And one of the recommendations from the EU Health Coalition is to build a multi-stakeholder forum for better access to health innovation and lots of elements, not just technology, but lots of elements of health, and greater partnership between regions and cities, but just to sort of, the health equality is a sort of big issue, isn't it, when we're talking in a time of crisis and in a time of not crisis in general terms. So, Dolores Montserrat, you're nodding. Could some sort of multi-stakeholder forum, because the coalition itself is already the start of that in a way, so would that make a difference?
Thank you, Kathy. I want to add on what Dr. Ivo explained. I think so that we have a big opportunity to give more budget to the national health system about we have the Next Generation Fund. The European Union institutions, Parliament, Commission, and the Council, we put on the table 750,000 million of euros to invest in our national health systems, in investigation, in economy, and to create employees, of course. But now we're talking about health. So I think so that the Next Generation Fund is a really important help that is going to help to our state members, and we have to use it. Good use, but we have to use it to promote our professionals, our nursery, our primary care, and our national systems, and to promote to the innovation. You were asking me about the access. Equal access for patients to health service is today more than ever one of the main Europe policy debates. The Commission, based on research results from the Horizon 2020 program, declared health inequalities among the 4 main challenges Europe faces in healthcare. Together with increasing costs, the influence on health of environmental factors, and the risk of not being able to protect citizens against infectious disease. Effective disease control requires innovation. Patients need early, accurate, and less invasive diagnostics that effectively guide new, more effective, and less harmful treatments. From direct experience, I know that many times patients' access to these diagnoses and innovative treatments is still limited because the health systems are not prepared to integrate it and offer it due to the high cost. Innovation cannot be an obstacle. A balance must be found between innovation, its accessibility, and the sustainability of the system. This is why there is a need to adopt more patient-centered approaches in national health systems with criteria for assessing therapeutic innovations that allow the choice of optimal treatments for all patients on the basis of outcomes. Health inequalities are an even more relevant issue when we talk about group at risk. So any citizen of the European Union has the right to be treated and cured with the most innovative treatments and the most effective therapies available, and the hope of having the same opportunities for cure and good health in all countries around the Union, whether living in a large capital city or in a remote island, wherever they age and social status. Of course that, it's difficult, but now we have this big opportunity, and for me it's very important the public and private partnership in the health sector, supported in particular by the European cohesion policy, needs to be broadened and deepened through synergies between the Horizon Europe, Digital Europe, and European Union for Health program. Now in Europe we have, for example, the European Plan for Beating Cancer, the European Strategy for COVID vaccines, together with the Europeans' new pharmaceutical strategy and a common European area of big data on health. So the Commission, the European institution, we are doing a lot during this last year because, the COVID is in our life. So now we have to deep in all these programs, all these instruments that give us the Commission and the European institutions, and we have to work together with the state members. And we have to ask to the state members to invest good the help, the solidarity that is coming from the European Union with this instrument that is the next generation. And of course that we have to put this next generation not just in the economy, we have to put it in innovation, investigation, and to protect and to support and to give more power, more power to all our national health systems. Thank you.
This new momentum for health in the EU, Nicola Bedlington, do you think this is the moment that patients' voices will finally get heard properly? And do you think that, in something like this multi-stakeholder forum idea, do you think that would be the opportunity for patients to really play a much bigger role?
Yes, in brief, I think that this idea of a multi-stakeholder approach to ensuring equity of access has a lot of potential. I think back more than 10 years ago to the high-level pharmaceutical forum that had similar sorts of aspirations, but focusing specifically on medicines, and the value of bringing people together with different perspectives to really sit around the table and find solutions collectively was enormous. I think this idea is extremely valuable, but moving further beyond that, I think if we're really genuine about a European health union, we need to involve citizens, for example, in the conference on the future of Europe. They need to be front and central in the design of that conference and really be able to contribute effectively. We also need to think about inclusive governance. When we think about the European health data space, patients and citizens, civil society need to be properly represented there. When we think about the EU for Health programme that is centrally about driving forward better health, better outcomes for patients and citizens, they also need to have a seat at the table. Those are the things that will really make a difference moving forward.
So moving forward, the Portuguese presidency is coming up. So Dr. Ivo, what would you like to see as a priority that in terms of healthcare that would be promoted by the Portuguese presidency?
Well, of course, there is the COVID issues that will clearly be at stake. So we have to continue dealing with these issues. I think here of course, we are very well coordinated at the level of the trio, the three presidencies. But I would like to say that one clear topic that we want to pursue is the one related to something we call a little bit of a kind of trio, the availability, access, and affordability of medicines. I mean, we have experience of working together with patients, with health professionals, with all the stakeholders, but looking at what is coming up at European level as well in terms of the proposals that the Commission is putting forward, we will pay very key attention to those issues. So we'll deal with these aspects all together in a way to use this moment to move this discussion. We are planning to hold a conference during our presidency. We have to see what will be the conditions to organize it. But clearly, we think this holistic approach that we have been discussing many times should be considered, and we will have it on our high on our agenda during the next semester. So I believe that this kind of group or platform that you are referring to is of course is a positive approach. But I also believe that we need to, as I said in the beginning of my intervention, I think we need to move in concrete terms. So it's important to have these platforms, but also we need to move in terms of concrete terms. And I think in these areas of the availability where we clearly need to have concrete actions vis-à-vis the basic medicines. There's no way to have a system where we are discussing innovation, which is very important, but also we need to have the basic products that are necessary. So all these aspects need to be looked at, and I hope that the Portuguese presidency will be able to deliver on these very key aspects of the.
Thank you. Well, just in the last couple of minutes, I just wonder whether I could ask each of you in just 30 seconds to give a sense of if there was one priority action that could be picked out of the recommendations of the EU Health Coalition, what would it be? I mean, it could be European health data space, it could be ensuring there's a research and innovation hub, a multi-stakeholder partnership, ethical AI. There are 10 recommendations, which I think you've seen, but just one, the first thing that would really make the biggest difference in terms of really ensuring a better health system, or health policies at EU level. Who would like to start? Nicola, perhaps you would like to start.
Sure. I mean, it's difficult to pinpoint one single recommendation because they are, in a sense, interdependent and mutually reinforcing. But I think a common thread in all of the recommendations is collaboration. And this is the essence of the Health Coalition. This is why it was set up. And of course, this requires culture change, it requires trust, it requires a deep respect of all of the players around the table and an ethical framework to move forward. So I think if we could get it right on the basic fabric of that collaboration, we can move swiftly on the other recommendations.
Thank you. Despina Spanu.
I think all of these things are important and they can all happen on their own, but I think there's one thing that will make them happen so that they are coordinated and they mean something. We need to have a true European health union policy. Unless we move to that, you can have stakeholder fora, you can talk about AI in health. They will all be standalone solutions outside a wider context. The key in Europe is to have an EU-wide policy and to have the determination that you want to work under this area. I will give you the example of security. For decades, security was an area that was never touched upon by European policy making. 3 years ago, after Europe suffered terrorism, after cybersecurity became very prominent, all the heads of state said, we need a European security area. We didn't change any treaty, but we started going for it. And now we have a plethora of instruments that constitute the European Security Union. We need to do the same for health.
Okay, that's very clear. So, Dr. Ivo.
The one that is bringing added value for health coordination, health collaboration at the level. I think this is what I would see as a key one of the recommendations, so that it could build upon the needs of the member states. So I think it's number 4.
Thank you. And Dolores Montserrat.
With the SPINA, I really want Europe with a union for health. We need it. And the pandemic gives us opportunity, a lesson that the pandemic doesn't understand about borders. So the European citizens, they need more competence for the European institutions, and we have to be lead from the European Union, coordinate with the state members for a really, really union for health. We have to work in this way, and I'm sure that like an MP from the European Parliament and from my party, the EPP, I'm going to work and push for this union for health, because I'm sure that this is what the European citizens, they are asking, they need to protect all the health public from all the citizens.
Well, thank you. On that note, that's a very, very strong message to finish off the need for this European Union for health. So thank you all 4 of you for all your thoughts. Thank you for your questions as well.